Peter, thank you so much for taking the time. I wonder if you can just take me into the discussions here that went into the decision to invite the healthcare workers and why it was so important, a priority for the league to do so.
Absolutely. Thanks, Ryan. Clearly, when we saw the vaccinations beginning in mid-December, we started to have conversations with our health experts, with national and local health experts, including the CDC, about timing and possibility of being able to invite vaccinated healthcare workers who had been through both shots and the runoff period afterwards. And it started to build as there was an opportunity and a plan. And to your point in the intro, it was really about two things. It was about thanking and celebrating and honoring and giving hopefully a bit of joy to these individuals who have saved so many lives and been on the front lines, while also educating and advocating for the efficacy of the vaccine. And there are few platforms as large as Super Bowl on which one can do that. So that was part of our conversation as well. So being able to build a plan for 7,500 over the last month is something we're proud of and excited to bring that experience to these heroes.
And part of that 7,500, a large majority, of course, coming from the Tampa and Central Florida area, but also the opportunity for the league's 32 clubs to give back to some of those in their community as well. So I just wonder what the process was like for you in talking with the clubs and getting that all organized and put together to allow them the opportunity to thank some of those in their communities as well.
Sure. We still got some work to do, but it is, we're rolling out that plan now, but having it be a national invitation, if you will. So working with the 32 clubs, allowing each of them to invite 4 healthcare heroes, again, not only the free tickets, but they'll fly them down there and pay all expenses paid. That's part of, again, that the message of vaccinations and the thank you. While to your point, certainly a focused and majority coming out of the Tampa and Central Florida area, the host of the game. They've been great partners. Obviously, this is a different Super Bowl, but not the Super Bowl that they anticipated when they were awarded it. So really giving back to and connecting with all of the incredible folks down here where I am right now in Tampa is a huge part of it as well.
And of course, we mentioned in the intro as well that in addition to the healthcare workers, there will be also regular paid attendance for some fans. Obviously not, as you mentioned, the maximum capacity we're used to seeing with Super Bowls, and understandably so, considering the current circumstances. But I just wonder, the conversations with the league throughout the course of the year have been focused on public health officials, the CDC, the best way to keep fans safe at these games. So just how was that number of 14,500 approximately therein arrived at?
Yeah, Raymond James Stadium's obviously an outdoor stadium, approximately 65,000 seats in there. That's obviously pre-pandemic what we were hoping for. But we, over the spring and summer, obviously built protocols with those health authorities that you described for the opportunity to host fans in stadium. 21 of our clubs have hosted fans in some number throughout the season. In aggregate, about 1.2 million fans have attended a game. And it's really about how you do that and really stringent protocols, which will very much be in place around the Super Bowl. So small pods of 2 and 4, where those fans will sit, distanced from those other pods, and then making sure clearly mandatory masks. At the Super Bowl itself, we're upping that, and every fan, whether vaccinated or non-vaccinated, will receive a KN95 mask, so a really effective mask, as well as all of our distancing protocols and cleaning protocols as well. So that number, the 14,500, is on par with what we've done through the season in many stadiums, and have learned a ton through that process, and also seen that there has not been, based on those protocols, a spread coming out of any of those games, and we've tracked that closely.
And you mentioned it right there, the importance that the league has put on these guidelines to have fans be able to be at these games, because that is such an important part of the NFL experience, is hearing that crowd in the stadium, even if you're at home watching on television. So just, I know this has been a very long process for you guys, something you've been thinking about, as you said, since last summer. What's it like to see it now come to fruition here with the announcement that these fans will be in attendance. We're doing this.
It is a lot that goes into it, and you see the round numbers, but where it really hits you is the personal stories. We've had the incredible good fortune of surprising some healthcare workers over the last couple of days, and it just kicks in that reminder of both how special they are and how excited they are to have this opportunity to be at the Super Bowl.